Hey guys, welcome back to my channel, and if you're new here, my name is Kristina. In my videos, I talk about nursing school and a plant-based diet. If you like these types of videos, please like this video and subscribe down below. In today's video, I'm going to be talking to you all about how to take notes and what I do for my classes. Let's get into it. So for this video, I'm going to be telling you how I take notes for a specific class, and in this video I'm going to be showing you particularly how I take notes for my unstable or med-surg 2 class. So I know some people, they like to either use a PowerPoint and write notes with that, or you like to take notes on your iPad, or maybe you write out all your notes or you use note cards. There's so many different ways on how you could take notes. So everybody is different, but this is the way that I have used numerous times and I've done really well on my exams. So I just wanted to share this with you in case it might help. So I just want you to keep in mind that I don't do this for every single topic that I have to study for. I do this method, which is taking notes. I'll show you right here. So I actually write out my notes and I'll put like a heading up top, and then I'll write about the disease process going forward. So I don't do this method, like I said, for every single chapter that I have to do or have to study for an exam. I will do this for those topics that are very tricky to understand and they have a lot more detail. You can easily get confused between one disease and another because they're so similar. So I like to do this because I feel like when I write things, it somehow goes right into my brain, somewhere that I don't even know. And then when I'm taking a test, I'm like, some of the times I won't even have any idea what the answer is, but I'm like, I really feel like it's this one. And that has helped me so many times because there has been research showing that if you write out your notes, it will go into a part of your brain or subconscious mind. That's why they say repetition, writing out words. And I don't know if you remember, but when you were growing up, you probably had to write out spelling words several times because repetition is key. So if you're learning this in class and you have to fill in notes while you're in class, that's one time. And then when you redo it again, that's a second time. So you're doing that 2 times before your test, which is awesome. And then sometimes I'll even, like if I'm struggling with a topic, I'll go back into it and then I'll write it out on my whiteboard. I have this big whiteboard inside my living room, and I did this with my last test where I was getting confused between 2 different disease processes, and I was trying to really look at it. I'm a big picture person, very visual, so I was like, let me write this out kind of like a mind map. So what I did was I wrote like the heading up top, and then I wrote out each individual thing or category that would signify that disease. So I knew that, for example, Cushing's disease or Cushing syndrome, they would have certain features and there would be a certain distinction about those people that have that disease. And that was one side of the board. And then the other side of the board, I had about Addison's disease. So then I wrote which one correlates with what, and if there was an overproduction or underproduction of cortisol and aldosterone. And I was able to even think back inside my head when I was taking my exam, what side of the board did I have it on? So I knew on the right side I had overproduction of those hormones. So I knew right away that I had Cushing syndrome on that side. So I could never get that confused. And then on the left side of the board, I had Addison's disease, which I knew was the underproduction. So in my head, I knew left was underproduction, right was overproduction. So I was never able to get confused. I could still picture it right now because I did that a couple of times, or I walked through it a couple of times, and I was speaking about it and talking about it, and I was actually teaching it back to my husband, even though he doesn't know much about this stuff, but he was a trooper and he was just able to let me just talk about it so that I can kind of make sure that I understood what I was talking about. So I'm not sure how your teacher gives you their notes. So sometimes they'll just have PowerPoint slides, or for my class, they give us this like handout notes that correlates with the PowerPoint, but they're fill in the blank. So in class, you're filling in those blanks and you're trying to actively listen. And then afterwards, what I did was, like I said, I had written out my notes. So what I did was I wrote down key points like lab values that I needed to know, which I heard in the lecture because this was a recorded lecture. And then I wrote out different glands, and I did mind mapping for the diseases that were correlating with those particular glands. And then I did that for all of them. And I went back and I wrote signs and symptoms, medications that you would need. So anytime you have a disease process, you want to think, what are the signs and symptoms that the patient has? What are the disease processes that are associated with it, like underproduction, overproduction of a certain hormone? Is there something else involved in this disease process that makes it significant to that person or to that disease? And then another thing that I wrote out was the treatment. So what sort of treatment things would you give for this patient? Is it simply just surgery, or is it something as easy as just giving them medication? Or is this something that they grow out of, or is there no cure? So these things have to come into your mind when you're thinking about these different diseases, because these are the types of questions that they will ask you on your exams. What I also included was, what sort of diagnostic testing do these providers have to do in order to make the definitive factor of knowing that they have this disease? So for example, someone with diabetes insipidus, I'm reading right off here, they would have a water deprivation test. So you would test their specific gravity and their weight, and you would figure out this calculation to determine if they potentially have diabetes insipidus. So again, what I did was I put the title of what the disease is, and then I put like the reason or the cause of the disease. So one of the causes could be a non-toxic goiter. Another one could just be from certain medications, like a side effect from a medication. So I add those little details, and then I try to go back in my notes and I try to really think, what is different about this disease compared to all the other diseases? So that when I'm being tested, most of the time they come up with that. Most of the time the questions that you get are based off of what was significant about that disease process from the others. So I feel like it makes it so much easier, because if you find these distinguishing characteristics in a disease, then when you're looking at the questions, you're like, I know it, I know it, I know it, I know it. And you could just like kind of go through it so fast because you studied the right things. When you're studying and you're trying to just learn every single word on the paper, and you see 9 out of 10 of these things, they require surgery, that's not going to help you, because you're going to be so confused when you're like, if it gives you a slew of different things and one of them surgery, you're like, well, I know 10 different things that have procedures that require surgery. So you kind of don't have a lot to go by. So when you drill down and you have the specific signs and symptoms or those characteristics, it will help you immensely. So I'll know this forever, that Addison's disease, when they have this disease process, they'll have like a bronze skin pigmentation, versus someone with Cushing syndrome, they will have purple or reddish striae or stretch mark looking things across their abdomen. I know that because I looked for specific things that would potentially be asked on the test, and that was one of our questions. It wasn't like straight up which one is this, but it was similar to that in terms of you needed to know which sort of characteristic or sign and symptom was not part of that specific disease. So sometimes they could ask you a completely different way where it's like, all these are it, but what? So you do need to know quite a bit about each disease process, but like I said, if you're able to narrow it down and you're able to understand what's going on with the patient, then it'll be so much easier. So I automatically know that if I have a patient that has an influx of sodium, for example, I know that they're going to portray signs and symptoms of obviously being hypernatremic, because that's too much sodium, and then they will have hypertension. Everything will be increased. Their blood pressure will increase, their heart rate will increase, because their body's trying to work harder because of all this sodium in it. So you have to think about these things. And what happens with sodium, its water is always there, so they could have fluid overload. It just brings you into more and more things. But that's sort of things that I knew already before even learning about this. So when you're trying to learn about these different disease processes, use your other knowledge that you've learned from other classes and relay it to these diseases, because it will make so much sense and it will be so much easier to understand. I always, again, like to try to make patterns. So when I'm trying to study, I like to see what sort of pattern does this disease have? Is there a mnemonic that I can make up? Is there something funny about this word or disease that I can make up a story about so that I could remember different characteristics of it? And that has helped me a lot. So I would like come up with like, oh, Jill went to the store and bought berries, and then that would correlate to some sort of disease process. If you look up mnemonics, most of the time people have already done it before. So if you just try to memorize those, if you're having trouble really understanding a concept, that helped me a lot. So back to note taking. You can do the mind mapping for like the biggest things that are troubling you. If you have PowerPoints, what I like to do is take the PowerPoint, write all over it in class if there's additional information. If your teacher is the type of person that literally just reads off the slide, that will be a waste of time to print out all those things because they're just reading off the slides. But you could use those PowerPoint slides to go back into the book, find that information in the book, and you could add things that if you're like, oh, I didn't realize that, I wasn't sure about that, you could go back in and add those things so that you could remember key concepts about each different topic. So that's really helpful for if you have PowerPoint slides to work with. Now, one of the biggest things that I want to mention is that when you see your syllabus and you see, okay, for one exam you have 10 chapters, do not freak out. Again, if you see on your exam syllabus or blueprint, testing blueprint, whatever you want to call it, do not worry about seeing 10 chapters for an exam. There is no way that they're going to test you on 10 chapters of a textbook. It's just impossible. If you have 55 questions, even if you have 75 questions, they cannot test you on every single page of those 10 chapters. It's just not realistic. What you have to do is go by what they are teaching you in class. You have to speak to your professor and understand what they're going to be testing you on. Most of the time, they will be upfront and honest with you, and they'll say, just listen to what I'm saying in class, and that's what you'll be tested on. Or some will say, it's free game, anything in the book, anything what I tell you. If they say that, okay, so be it. I would focus on, like I said, learning the PowerPoint, understanding that material, going back into the book and reading those different concepts. Now, someone had actually told me some really good piece of advice where they said they go towards the end of the chapter and it'll say like what you should have learned or key concepts, things like that. Look at that, because that's a good summary about the whole book that you didn't even have to go through because you had the key concepts at the end of it. So if you read over the key concepts and you understand them, then you know that you understand that chapter or a good amount of it, enough to do well on your exam. Another thing I want to mention is that I don't suggest writing out every single detail for your exam. So if you're the type of person that you could work ahead and you're able to have your lecture and then write out your notes right away, so be it. More power to you. But I personally, I take a day or two before I'm actually able to go over the material because I normally have 1,000,001 things to do. And I also am a mom and a wife, so I have a lot of responsibilities. So for me, it's too time consuming. But if you have that time, by all means do it. You could write out exactly how it will help you, make some mind maps, do some mnemonics, and you will be in really good shape. But if you don't have that time, that's okay too. Like I said earlier, write out the key things or the key topics that you need help with. So you could just focus in on those chapters, and then you could also look at the other ones, but you don't need to spend as much time because you could just read over the notes and try to memorize things in a proper way. So when you're trying to learn things, you don't want to just memorize every single little thing and then repeat it back to yourself and then just be like, okay, I'm done. You really, really need to understand these concepts in order to do well, because you'll see them time and time and again, and then of course they always say our NCLEX. So you want to be able to recall this information, and even though it may seem like a lot, you need to break it down. So if you have 5 chapters that you have to go over, spend a day doing each chapter, and just that will be your homework. Just go over one chapter at a time, and like I said, you don't need to read the full chapter, but even the PowerPoint associated with it, and going back and writing notes or writing out the hard chapter. Like, let's say in class you're like, I just didn't understand this, take your notes and write it out. And in class, make sure that you're really actively listening, make sure you're raising your hand, and that when you ask questions, make sure that you really understand what the teacher's saying, and if you don't, ask for clarification after class. Like always, I hope this video helped, and if it did, please like it and subscribe down below. If you have any questions at all, if you're like, I still need some help, that's okay, I will help you. Please send me a message on Instagram, even put a comment down below. I will definitely do my best to answer you as soon as possible. And if you have any ideas for new videos or need anything else, please let me know. I can't wait to see you guys next time. Bye.